Morning guys, just before I take the dogs for a walk, I'd like to run you through a pretty standard letter that I get from the NHS, whether it be the endocrinologist or the GP. Essentially, obviously what they're doing is they're questioning what service we're providing, why we're providing it, and I'm assuming they obviously just want some reassurance. So let's go through it. I would like you to provide me with some information regarding the underlying diagnosis stroke indication for testosterone treatment. So on the next page, Mr. X has been struggling for 5 years, has seen the GP, seen us at the endocrinology department, and he has had persistent symptoms of low testosterone, all the usual things. So, blood tests. We're obsessed by blood tests. So let's see what his blood tests show. 23rd of June 2015, testosterone 8, free testosterone 227. 30th of June 2015, testosterone 14.2, free testosterone 405. 13th of February 2017, 12.9. 27th of March 2018, 9.8. 14th of May, 12.7. So all very borderline stroke low levels. Some of those levels would indicate treatment according to the BSSM guidelines, some of them wouldn't, but they're all very, very borderline. Now, we've had this discussion about the reference ranges before, so we don't need to really go over that, but this guy has been struggling for 5 years. He'd been back and forwards to the GP, the endocrinologist, and always had very borderline blood test results. So what should he do? He'd address lifestyle, he'd addressed his diet, he'd addressed his exercise, he'd looked for a reversible cause, and his levels were still low and he was symptomatic. So quite reasonable to give him a trial of testosterone replacement therapy, something that the NHS did not want to do because on occasion his blood test results were within normal parameters, ignoring the fact he was symptomatic, ignoring the fact that numerous blood tests showed that he was under the reference range. But you know, we always go on the highest one because we don't want to treat, do we? So he subsequently came to see me and we commenced him on testosterone enanthate and Hcg. Since starting these treatments, you have felt 100% better. Wow, that's incredible. And does that not just demonstrate the fact that we shouldn't actually be concentrating so much on numbers and we should be concentrating on qualitative symptoms? I think so. So the other question was, why do you prescribe Hcg? Your symptoms have entirely reversed, except that you do feel tired some of the time. Wow, you know, funnily enough, people do feel tired even with normal testosterone levels. Your wife has just discovered that she is pregnant with your second child, and you're wondering why I prescribe Hcg. So yeah, fertility. Hcg has other important functions. So there's upregulation of the other hormones, down from pregnenolone down to aldosterone, cortisol, and testosterone. And also there are electrolytes in the brain. I'll put a link to one of the blogs that we've done before regarding the importance of Hcg. So there, you've got your answer. You answered your own question. Why do we prescribe Hcg? And you've just said his wife is now pregnant. Let's work it out. Okay, what else? They're concerned we haven't found a cause. Now we know he's got a secondary hypogonadism because his LH and FSH were low. However, we could not identify a cause. it's very difficult to identify a cause because we never have the data. So, we don't have pre and post incident stroke event markers. So it's very difficult to identify causation. Enough! Sorry about that. Dogs are ready for their run. So yeah, it's difficult to prove causation, but you must identify and address any reversible causes, which is what we did. So obviously looking at prolactin, thyroid, etc. And so yeah, we commenced him on testosterone replacement therapy. Now remember, he's 100% better, and his wife is now pregnant. So what do the NHS want to do? The NHS want to stop treatment. They want to stop treatment to see what happens to his levels when he goes cold turkey. And they want to see if they can identify a cause. You had 5 years to identify a cause. 5 years. And now you want to deliberately make him hypogonadal again. 5 years. And you want to lower his testosterone so that he does not feel 100% better. You want to lower his testosterone so he has a return of all the symptoms that he complained about to you for 5 years. Very interesting. Okay, now the other question was, why do we prescribe testosterone and Untitled so frequently? Now the answer to that is you have to have a basic understanding of pharmacokinetics and pharmacodynamics. That's all. So we titrate the dose and frequency according to response. And obviously when we design a protocol, we take other parameters into consideration. So the reason why we prescribe this gentleman testosterone every other day and HCG daily is because it was right for him. Here at the Men's Health Clinic, we offer a personalised service that's tailored to your genetics, your physiology and your requirements. There are no cookie cutters here at the Men's Health Clinic. Testosterone and Untitled is normally prescribed every 2 to 3 weeks and between every 3 to 6 weeks for maintenance, not on alternate days. Yeah, so, a basic understanding of pharmacokinetics and pharmacodynamics will tell you that that is an inefficient stroke ineffective way of prescribing testosterone and Untitled. How do we know? 350 patients. Aside from having a basic understanding. Yeah, proof is in the pudding. What else? I think we're done here. I think I need to take the dogs for a walk. Yeah. So these are some of the hurdles that we face and some of the barriers. I'll write back to this doctor and essentially give them the heads up on what they're doing wrong and why we do things the way we do things. Who knows? All we can do is keep spreading the word, keep trying to keep educating people. And it's not just the public, it's the doctors as well. It is shocking. But we will continue and hopefully make more of you 100% better. And you won't have to go through the ordeal of being told you're normal when you're clearly not normal, and normalizing, as in optimizing, as in bringing your testosterone levels up to levels that are within normal physiological parameters and making you 100% better is probably the right thing to do. Right, I'm off.